Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. As we said earlier in the show, May is Mental Health Month, and the most common form of mental ailment is simply stress. Deadlines at work, financial challenges, and personal relationship issues are just some of the daily factors that contribute to a person's stress level on an almost daily basis. Well, good management of stress can result not only in a better quality of life, but also in a better overall state of physical health. Well, joining us to discuss proper stress management is Dr. Lance Foster from Ozark Guidance Center. Welcome, Dr. Foster.
Thanks.
All right, tell us how the effects of daily stress can add up and even have physical effects on a human being. Is that right?
It is right. Not all stress is bad, though. Some stress helps us to do well on things that we need to do well on, like tests or work assignments, those kind of things. But when stress happens again and again over time, it can affect us in many health ways. Our nervous system is affected by that. Our digestive system is affected. Our heart and circulatory system are affected by that. So it can affect us in many ways.
Absolutely. And how have changes in our society over the past few decades made life and our lives more stressful overall?
I think having the fast pace that's picked up, where things are coming at us from different angles at all the time, where we've been more and more disconnected from families, more isolated as people, and also having so much information coming at us, so many things coming at us all the time that we're just bombarded from the time we get up until the time we go to bed.
Absolutely. So as you mentioned earlier, Dr. Foster, some stress is good for us. We all need a little bit of stress in our lives, but when it gets to the point when it's too much, too overwhelming, what are some steps that an individual can take to help reduce that load of stress on their lives?
Well, we like to think of the 4 A's.
Sure.
We think of avoiding the stress, adapting to the stress, altering the stress, or accepting the stress.
Okay. All right, and have you found that recipe of the 4 A's has been successful for most people?
I think so. When we look at accepting the stress, the things we're talking about are realizing our own limitations, realizing things we can change and things we can't change.
I see. From your experience, what would you say is a major contributor of stress in an individual's life? Is it work, usually, or finances?
All those things. Really, any aspect of our life that we spend time in and spend emotional energy in can be stressful.
What about having a healthy diet and exercise? How does that play a role in our overall well-being, not just physically, but mentally?
Well, as stress affects us in a physical way, if we can be healthy in other ways, if we can get good sleep, if we can get a healthy diet, we can avoid alcohol and tobacco and caffeine, or cut back on those things, avoid drugs, then that can help us to be healthy as well and help us to react better during stressful times.
Sure. So, just simply eating a bad meal, fast food all the time, that can actually make you feel more weak and fatigued and have an impact because of the processed chemicals that are put in those foods can impact how we feel. Is that correct?
Absolutely. And along with that, exercising, feeling good,
Sure.
Improving your health in other ways can help lower stress.
Sure. And what about someone that drinks too much alcohol or eats too much fast food? Ultimately, if they're continuing to put these toxins and poisons in their bodies, how does that play out, years from now? If someone develops, for example, liver cirrhosis from too much alcohol, that can make them more depressed, cause anxiety, panic attacks, that sort of thing. Right. Do you see that a lot in your clinic with your patients?
We do some. Having things that are attacking the body in the same way that stress attacks the body, so the nervous system, for instance, or the cardiovascular system or the digestive system, just double your problems, really.
When someone has anxiety or depression, sometimes if it's not controlled with, changing, like you mentioned earlier, altering the stressor or adapting, they may end up needing to be on medications. And those are usually medications that alter the chemicals in our brains, serotonin, norepinephrine, that sort of thing.
Right.
And the medicines the toxins that people put in their bodies, alcohol, drugs, that sort of thing, can counteract and even cause more problems. Is that correct? And even make underlying mental disease and disorders worse?
Right. When we're dealing with chronic exposure
Sure.
to those types of
Sure.
toxins, or we're dealing with stress, we can actually change the structure of our brain and change the pathways so that things become small stresses affect us in bigger ways, and it's a snowballing type of effect.
I see. If someone has gone into a state of depression, say from alcoholism or excessive marijuana use, is it reversible? Are the conditions of anxiety and depression reversible if they cut down on those toxins and poisons they put on their body, or is too much damage have already been done that really it's just a matter of maintaining and preventing worsening of the anxiety and depression?
Yeah, usually the folks we're seeing, it's very very much something that they can become much better with. It's not a matter of preventing worsening, it's a matter of improving, rehabilitating.
I see. If someone has that type A personality and is usually stressed out all the time, does that tend to run in families? Is it hereditary? Usually they'll have parents who are always stressed out, or just usually it's just a stressful lifestyle. What do you think?
Both those things. We certainly see that anxiety levels, depression, those things run in families, and so along with that stress and how we deal with it.
And especially in young people, it's important to manage stress, because is it true that if someone encounters a large stress in their life, perhaps a death in the family or the loss of a job, that if there is an underlying predisposition to mental disease, for example, it can push them into schizophrenia or anxiety, depression, that sort of thing? How often do you see that?
Certainly, what we believe is that there's the biological nature of disease and the social nature of disease and the environmental nature of disease, and all three of those things can push you further one way or the other. People that are prone to anxiety or depression because of family history, events in their life may make that more likely to occur. And so how we deal with stress and how we deal with these environmental insults.
Sure. You mentioned diet and exercise, very important, but why is sleep so important as well?
It's a time when we rejuvenate ourselves. Sleep, in children, we see behavioral problems that are associated when we don't get good sleep. In adults, we see changes in cardiovascular system, blood pressure problems. We see obesity. We see a lot of things that are affected by bad sleep. And anxiety and stress is one of those things that's aggravated.
Sure, that's why it's so important to relax and recharge your batteries, as they say, throughout the day.
Right.
Okay.
Right.
And what would you say is the best attitude one can have when approaching a stressful situation? Some people shout and scream and yell, and some people hold it all in and bottle it up. Right. Would you say is the best approach?
I think when we can be optimistic about new situations or stressful situations, when we can understand what's going to happen. So having that idea of, I know what this is going to be, this is what I'm going to be dealing with. But when we can enter it thinking this is going to turn out all right, I'm going to get through this, then we do much better.
Very good. Are there local services available, Dr. Foster, that one can reach out to and get more information or get help with stress, anxiety, or depression, or even if someone is suicidal, doesn't know what to do?
Absolutely. Certainly, I work at Ozark Guidance, and we have folks available. But reaching out to your physician, your family doctor, pastors and counselors in the area. The main thing is to seek help when you're having trouble dealing with those things, and family and friends aren't offering enough of that.
All right. Any last-minute words of wisdom for our viewers, Dr. Foster?
Well, I think I think just to reemphasize the things we've talked about: exercise and eating well, sleeping well, staying connected. Finding ways of being in the community, doing for others, those sort of things, getting outside your own head help us to do better with stress.
Right. Very good. Well, excellent advice. Thank you so much for sharing it with us. We appreciate it.
Thanks.
All right. Stay tuned. Family Health Today. We'll be right back.